Okay, hello everyone. So I'm going to talk about both pension and healthcare reform. And the two parts of my presentation are going to follow a similar outline. So we'll start with some basics for both subjects. Then we'll talk about the current state of affairs in Iran. And after that, we'll share our long-term vision for reform in Iran. And finally, we'll describe the transition process to get there. Okay? So there's actually a common theme to both of these topics that is caused by Iran's rapidly aging population, okay, which is due to its dramatically falling fertility rate, as you can see here, and also continually rising life expectancy, right? And as the population gets older and older, this is, of course, going to put severe pressure on both of those systems, right? Both pension and healthcare. So there's a common theme here. Now, I'm going to deliver the punchline first, okay, by talking about our long-term vision, and then we'll get into details, right? So here's our pension proposal. For pensions, we want to switch eventually to a fully funded defined contribution, or FDC system. It's going to have a 12% contribution rate, and the split is going to be 5-5-2, including a 2% contribution by the government. This 12% is very similar to existing FDC systems in Australia, Denmark, and Israel, and actually a bit higher than Chile's 10%. And some people argue that one of the reasons that the experience in Chile was not maybe as successful as people had hoped was that the contribution rate was not high enough. So, we're going to make it a tad bit higher than that. And these contributions are going to be invested in globally diversified financial assets, and people will have choice, okay, over who manages those funds, those investments. There will also be some so-called nudges, right, lessons rooted in behavioral economics, to basically encourage more participation and encourage more saving, more participation in this program. Now, upon retirement, those investments will be either fully or partially annuitized to provide retirees with a steady stream of income, right, and protect them against further risk. And for contributors to the FDC system who nevertheless had low lifetime earnings, and as a result, their savings are not high enough, right, to support a minimum standard of living in retirement, they will qualify for regular income assistance. Okay? So how about our healthcare proposal? Our healthcare proposal is going to be based on medical savings accounts. It's going to be a market-driven model inspired by Singapore, which also has MSAs. It's going to have an 8% contribution rate, again, including a contribution by the government. The provider network is going to be largely, private to encourage competition, and prices will be largely market determined. We will have targeted income-based subsidies to cap the spending on the minimum benefit insurance package to 5% of every individual or household's income. And this is inspired by the existing system in Switzerland. Okay? And then contributions to MSA and enrollment in insurance will be either mandatory or, we're going to auto-enroll people and allow them to opt out later. This depends on how paternalistic we want the government to be. So that's a debate for another day. Okay, but we have both of these options. Okay, so let's start with pensions. Let's cover some basics and terminology first. So there are three basic objectives to any type of pension policy. One is consumption smoothing, and that is captured by the replacement rate that the pension plan offers. Okay, the replacement rate is the ratio of your pension benefit to your pre-retirement income. Okay, and on average for OECD countries that is 61%. In Iran, as we also see later, it's 83%. Okay? The second function is insurance against outliving your retirement savings, right? In other words, insurance against longevity risk, okay? And that function is served through annuities. Finally, you have the poverty relief component, and that is usually captured by giving low earners a higher replacement rate than the average worker, okay? So in the OECD, for low earners on average, that replacement rate is 73% as compared to the 61% for the average worker, okay? Now, there are a number of dimensions along which we can classify pension systems. One is defined benefit versus defined contribution, okay? So in DB systems, benefits are exogenous, and then contribution rates are kind of endogenously determined to match those payouts, right? Whereas DC systems are the opposite, okay? Another way to classify them is paid versus funded, all right? So paid or pay as you go means that pension benefits are paid out of contributions by current workers, right? Whereas funded means benefits are paid out of accumulated and invested funds, okay? Now, under certain assumptions, a PAYG system gives you a rate of return on your contributions that is almost equal to the growth rate of the aggregate economy, okay, or big G here. So to get a perspective, big G for the US is about 2 to 3% per year, right? And that big G itself, of course, is a function of population growth as well, right? So you can already see that as fertility rates fall and population growth rates fall, okay, PAYG systems start to get into trouble, right? For funded systems, what's the rate of return? Well, if you, for example, assume that it's fully invested in US equities, right? The rate of return that you can get, that little r there, is about 9 to 10%. That's real return on the stock market, right? So in the long run, now, in Iran, the short-term dynamics could be a little different, but what we care about is the long run, okay? And in the long run, you almost always have that famous R, for those of you who are familiar with Thomas Piketty's work. You have that famous R greater than G equation, which means that funded systems give you a better return, right? Give pensioners a better return on their investments and contributions than PAYG systems, okay? And that is one of our main motivations for wanting to switch to funded systems. So right now there are 17 pension funds in Iran that cover about 75% of the population. And the largest one is the Social Security Organization, which covers about 54% of the population, followed by the one for civil servants, okay? And there are other ones for armed forces and the rural population and so on. Now, these pensions are mostly DB PAYG, okay? They are partially funded in the sense that they do make some investments, right? But their investments do not yield that much, right? So they're mostly DB PAYG. And the present system suffers from a lot of issues. So it's overly generous, at least on paper, right? But that's actually kind of paradoxical because that generosity makes it unsustainable, right, and results in a funding deficit. And to fill that gap, the government starts printing money, right? And that creates inflation, right? And reduces the standard of living of everyone, including the pensioners, right? So on paper, it's overly generous, but maybe not in reality, okay? It's also highly fragmented. As you saw, 17 different pension funds, and that raises issues with mobility and fairness. It is poorly governed. It encourages non-compliance, and so on, okay? So it's a long list. I'm going to focus mainly on the SSO, right, because that's the largest fund. The total contribution rate for the SSO, and remember that SSO also has a health insurance and unemployment insurance part, right? We'll get to those later. This is just the pension part, okay? The pension part, the total contribution rate by employee, employer, and government is 21%. Government share is 2%, and the government often doesn't pay it right away, okay? So this actually is one of the highest rates in the Middle East and North Africa region, all right? And that is one of the factors that causes non-compliance with the system, okay? The formula for calculating the pension benefit is this factor of 1/30th, which is also called the accrual rate, okay, times the number of years that you've contributed to the system, times your average earnings over the last 2 years of contributions, right? So this last 2 years is also highly unusual. Most countries in the world either use lifetime or say at least 25 years, at least, okay? This is also another factor that causes non-compliance, by the way, okay? The accrual rate, that captures basically how much extra you get, right, in pension benefits for every additional year that you contribute, okay? And at 3.3%, it is also much higher than other MENA countries, right? 1.5 to 2.5%. And as a result of all of this, the average replacement rate is 83%. Remember, OECD, the Club of Developed Countries, is only 61%, all right? So these are all of those, generosity on paper components that I was just talking about. Now, the early retirement is a huge issue in Iran, right? So the average effective age of retirement is about 51, okay? And that is because until recently, basically, legally you could retire as early as 50 if you were a man, or 45 if you're a woman, or even earlier in some special cases, right? Now compare that 51 years of the average retirement age with life expectancy, which is about 76 to 80 years and growing, right? So this, of course, causes a huge problem with unfunded and growing liabilities in the system, right? And the government, recognizing this problem, actually in 2023 raised the retirement age for men only to 62, okay? But that is still lower than the OECD average, which is about 64, okay? And here is what Iran's population pyramid looks like right now versus what it'll look like in 2050. So you will just have a larger and larger number of older people who have to be supported by a shrinking number of young workers. Okay, so now, having replacement rates that are close to 100%, right, and support ratios, the support ratio is the number of contributors per pensioner, okay? Support ratios that are below 1, all right? The CSPF and the Armed Forces Pension Fund are already illiquid, okay? Basically 90% of their funding just comes from the government. Contributions and investments don't pay for it, right? And they are consuming 62% of the government's social welfare budget already, okay? SSO with a support ratio of 4.2, which is not considered perfectly healthy, but it's still not that bad, okay? It's still liquid, but because of its long-term unfunded liabilities, it is insolvent. So by some calculations, the present value of its unfunded liabilities is about 220% of Iran's GDP. And by the government's own projections, right, the funding gap of Social Security alone by 2055 will reach 15% of Iran's GDP, which is equal to the entire government spending in Iran, right? And by 2090, it'll reach 50%, okay? So they're all in a dire situation. Now, what is our long-term plan? So first of all, let me say that there has been a worldwide movement toward this model that we just talked about, toward a move toward FDC systems, okay? So Iran will by no means be unique in this. So the 12% total contribution rate will be will go to mandatory individual retirement accounts, or MIRAs, right? And be invested in various assets, right? We already talked about this. So the government contribution, unlike the 2% government contribution that we have for Social Security right now, this is going to be a flat contribution, right? It's just going to be a flat amount equal to 2% of the national median wage, because we don't want the government to subsidize high earners, right? There's no fairness justification for that, basically. So it's going to be flat. And we put this here partly to address the demand to redistribute oil rents, which we believe will exist in a future Iran. And we will make it conditional on the individual contributing to the MIRA system to basically encourage more compliance, right, with the system. So again, investments will be annuitized upon retirement, and this, again, can be either mandatory or we can auto-enroll people with it with the option to opt out. And then if someone's lifetime contributions are not high enough to generate an income that is above the poverty line in retirement, then they will qualify for regular anti-poverty relief. But this option will be open only to those who contributed to MIRAs during their working years, because we don't want to basically destroy the incentive to invest, right, in your working years and just be reliant on this program. So it'll be only available to those. Another way of encouraging compliance with the system. How about the transition process? So most countries that switched to FTC had the government honor its obligations to existing pensioners, right? And that's what we're planning to do as well. But in those countries, this generally involved issuing new debt, new government debt, right? And that debt, of course, has to be paid out of additional taxes, right, on current and future workers. So that raises the question, does this really make, future generations better off, right? Given those differential returns on investment that we talked about earlier. But fortunately, in Iran, we don't have to think about this too hard, because Iran has massive natural resource rents, right, that can be used to fund this process without relying on heavy and distortionary taxation, right? And by the way, there will also be additional revenue available through privatizations to the government, okay, which can use to finance this process. Let me jump ahead a little bit. So Chile, who went through this process, had to devote about 4% of its GDP to paying those legacy obligations, right? And I don't have precise numbers for Iran because that would require very detailed simulations, but we're confident that it'll be less than 10%, let's say, okay, less than 10% of the GDP. By comparison, oil rents in Iran, in good years, when there are no sanctions, exceed 20% of the GDP, okay? So there's plenty of money, essentially, to pay these legacy obligations. Now, for the transition, we envision a two-phase process. Phase one is going to take 5 years, right? And the kind of main goal during that process, that phase, is to minimize the disruption, right? And continue to support existing and soon-to-be pensioners, right? So we'll preserve the core of the old system, but make some parametric reforms around it, okay? We will also prepare the infrastructure for the eventual launch of MIRAs, right? So what about those parametric reforms that we'll need to take to improve the system's short-run finances so that it doesn't put too much pressure on the government? Well, one element is going to be gradually raising the retirement age to 67, and then indexing it to further increases in life expectancy, as is done, for example, in Finland, Sweden, other countries. Okay? There will also be some reforms to that benefit calculation formula that I showed you, and these are recommended by the IMF. So the accrual rate will be gradually reduced to 2%, and that wage calculation window will be gradually increased from 2 years to 20 years. Okay, so it will have some beneficial effects even in the short term. And we'll also have governance reform, right? Now, I won't get into this, but one of our panelists later on will cover this subject in more detail. In phase 2, then, we will shift people younger than 50 to MIRAs, right? And we will compensate them for their prior contributions to the legacy system, right? Again, out of various sources of revenue that will be available to the government. People older than 50 will stay in the legacy system, right? Because we just don't want to disrupt their lives and their plans too much, right? And they're already 50, right? So they have too short a horizon to kind of save and accumulate and grow their savings. So they will remain in the old system. They will not receive any compensation, but will be paid in accordance with the old benefit formula. Okay? All right. Let me talk about healthcare reform now. So again, first, the current state of healthcare in Iran. Okay, the title for this one I think is wrong, but so on the supply side, okay, the public sector is the main provider, right? And there's also a close integration, and somewhat unique worldwide, integration of medical education and healthcare provision. In fact, both of those are under the same ministry, okay? There is something called the Iranian Medical Council, or IMC, okay, which licenses medical professionals and sets private sector prices, right, that everybody has to follow, okay? And by the way, these prices are sometimes referred to as tariffs, not to be confused with import tariffs, which are a different thing, right? There's something else called the High Council of Health Insurance, which defines the minimum benefit package for insurance and also sets prices or tariffs that insurers, A, and B, public hospitals and medical facilities must follow. So there's two sets of tariffs, and we'll return to this. On the financing side, total coverage is above 90%, and about half of that comes from Social Security, right? So this is the healthcare component of Social Security, which also had a pension component, right? And the other half is something called the Iranians Health Insurance, which covers groups like government employees, students, and so on. Social Security insurance is mandatory for all private sector employees and employers, okay? And the contribution rates for these programs range from, say, 7% to 9%, okay? And that includes a 1% contribution, again, by the government to Social Security, all right? Okay, again, the title for this one is wrong. So what are some of the problems with the current system? Many, right? But a number of those are barriers to competition in the provision of healthcare, distortionary price controls, again, fragmentation, limited choice in health insurance, and so on. Okay? Now, before we talk about our reform proposal, we have to talk about the topic of moral hazard or overutilization, okay? Which is a problem that every reform plan has to address. And moral hazard really afflicts all insurance, right? In the case of health insurance, empirical evidence for it comes from two of the largest experiments that were conducted in the history of social sciences. One was the Rand health insurance experiment, which started in the 1970s and lasted into the 80s. The other one was the Oregon Medicaid expansion experiment, right? Both conducted in the US, okay? And the interesting result from these experiments is that people who are on insurance plans that pay for 100% of everything, right? They consume a lot more healthcare than other people without getting any tangible health benefits from it, okay? So people tend to think that all healthcare matters are questions of life and death. Not so, okay? The empirical evidence doesn't show that. Not only that, they also take more risks. Okay, so here's an interesting factoid here for you. In the Rand health insurance experiment, people who had the full insurance, they were 25% more likely to end up with bone fractures and dislocations, and 35% more likely to be hospitalized for substance abuse. Okay? So we have to deal with this problem, right? And of course, the traditional solution to this is cost sharing, right? Things like co-pays, co-insurance deductibles, things that everybody tends to hate. But they serve a necessary function, because if we don't have those, everybody will just spend more and more, consume more and more, and the premiums for everyone will rise, right? Now, on this chart here, I'm showing the share of out-of-pocket expenditures on healthcare out of total healthcare expenditures, right? And just two things that you may notice. One is this group of countries here, South Korea, Switzerland, Singapore. As you'll see, those are countries that we view as models. They have fairly high out-of-pocket rates, around 30%. Okay? The US, oddly, is at the bottom of that list, and that is one of the major problems that we have here. Now, Iran is at 40%, but the crucial thing is that that's not by design, as we'll see. So it's actually a result of certain flawed policies, right? And what we plan to do is we'll fix those flaws, but we will maintain an element of high OOP to encourage cost control. Okay? Let me skip this. So healthcare around the world, there are broadly three categories of healthcare systems around the world. Single-payer healthcare systems feature both public provision of healthcare and public health insurance, right? So that is your Canada, UK, Scandinavian countries, Spain and Italy, so on. The second group is Bismarckian, countries that follow the Bismarckian model. And provision is mostly private in those countries. Health insurance, while it can be nominally, non-profit private, it is practically public. Okay, so that's Germany and France and so on. And ultimately, we have market-driven countries in which, again, provision is private. Health insurance, you actually have no country that in which insurance is totally free of government intervention. But you could say that it's less than the other two groups, right? And that is your Singapore, Switzerland, the US. Okay? By the way, there's some exceptions like South Korea, which combine single-payer insurance with private provision and high OOP spending. Okay? Now, one thing that you can notice in this figure, which shows total health spending as a percentage of GDP, is that Denmark and UK, look at Denmark and UK, right? Those are single-payer countries that tend to spend less than their counterparts, right? But market-oriented systems with high OOP, they tend to do the best, okay? So how have single-payer systems limited their expenditures? They have mostly done it through things like gatekeeping, capping physician incomes, limiting investment technology, and that has had some negative consequences, right? Rationed care, long wait times, preventable deaths, and so on, okay? On the other hand, countries with market-oriented healthcare and high OOP have also accomplished that goal without, any of those unintended consequences, right? And life expectancy is by no means a perfect measure of the quality of a healthcare system, but you can see that, the three countries that we're talking about as potential models, they're right there at the top of the list for life expectancy around the world. Okay? And by the way, single-payer systems tend to prioritize equal access, right? But contrary to popular belief, they don't deliver that well in practice, all right? So for example, people with low socioeconomic status face significantly longer wait times in Denmark, okay? Life expectancy inequality between the rich and the poor in Norway is almost equal to that in the US. Practically no difference, okay? And also when it comes to things like medical tourism from Canada to the US, right? Canadians who come to the US because of the long wait times that they're facing, who does that primarily benefit? Rich Canadians, right? So for these reasons, we don't think single payer is a good plan for Iran, right? Now, let me quickly get to our proposals, our long-term proposal. So we will combine, one of the slides is missing here. We will combine medical savings accounts with high OOP insurance. And for subsidies going to health insurance, we will follow the Swiss subsidy system, okay? So in Switzerland, if the cheapest offered minimum benefit package costs more than 8% of an individual's income, the difference is paid by the government, okay? So we're going to do the same thing in Iran, except we're going to set that threshold to 5% of income, all right? We will abolish all price controls, okay? Those that are imposed by the High Council are too low. Those that are imposed by the IMC are too high. Okay, we will abolish both of those. And that is going to solve a whole bunch of problems, which unfortunately I don't have time to get to right now. We will also do some supply side reforms, like abolishing pharmaceutical tariffs. There is a point system for obtaining a license to practice in a large city, right? So we'll partially preserve that, at least in the short run, because we don't want urban-rural disparity in healthcare access to explode. But we will reduce the location specificity of those licenses because it creates local monopolies, right? And there's more, including quality control, which our panelists will cover. And let me just say something very briefly about our transition plan. Of course, we have a very detailed plan, but I'm just going to give you an overview. So during this transition period of 5 years, during this entire period, the government will continue to do certain things, right? So one is it'll continue to run the IHI plan, which is run by the government right now, okay? And it'll also enforce the mandate for participation in Social Security insurance. And that is because during this transition process, we can't allow young people on that plan to immediately leave, because otherwise the plan will collapse, and then old pensioners will be left out in the cold, right? So, through a step-by-step process, basically, we will transition the IHI population to the new plan first, right? And once everything is in place and we have a successful demonstration, then we'll basically eventually allow everyone to switch to that plan that we're envisioning. Okay, thank you so much.